It is 10:15 and time to start page 2 of the morning magazine. And to help us do that, we welcome back to the program. His name is David Stokes with the Show Me Institute. Good morning, David. How are you?
I'm doing great, Manny. Great to be with you.
Well, let's talk this week about ambulance practices. Isn't it interesting that we get into all kinds of different conversations on Show Me at the Lake? Last week we were talking about docks, and we've talked about different taxing entities and different taxes. And this week we're going to talk a little bit about an issue that maybe folks in the Lake Ozark Fire Protection District are aware of, but maybe they're not, when it comes to ambulance fees and ambulance service. And, what have you taken away from this so far?
Well, what I've taken away is that I don't see anything wrong with the decision by the Board of Directors of the Fire District not to charge taxpayers the out-of-pocket costs. I think that's perfectly reasonable. What I find perhaps amusing is that over the prior decade, when it was unclear to a lot of people, I bet they received a lot of unnecessary checks that they still cash. And I commend some of the citizen activists who sort of fought to spread the word farther on this, to say, no, when you get this bill, your insurance company is required to pay their portion, but if you're a taxpayer, you don't have to pay the other part of it, to make sure that people are aware of the policy. It's, good government policies don't achieve very much if people don't know they exist in the first place.
Well, and this one, I'll be honest with you, it's been around since 2000, but it is a little confusing the way, and it's not so much the way that it's written, but I think it's the way that it's been presented, or maybe the way that folks have talked about it when it comes to, first of all, if, let's say you're in Lake Ozark and something happens and you have to go to the hospital and they need an ambulance, and then who that bill goes to, and then how much the cost is. It does get very confusing, and especially because I guess if I understand it right, the fire district doesn't actually bill you, but it's an outside company that bills you.
It's an outside company that bills you, and that's fine. It doesn't make sense for the fire district to have its own billing department. But it's a great example of one of the problems that we have in healthcare. And the Show Me Institute has published a whole study on this that people can see at our website, showmeinstitute.org. It's about the healthcare wedge, that because of the third-party paying system, because the person paying it doesn't have any input in the service received generally, and because the person getting the service doesn't care about the price, that it leads to higher costs in health care, and that's one of the major reasons for it. And this is a good example of it. If the law here says, the rules are that they're going to charge a lot of money for the ambulance district, and you just forward it to your insurance company, and they'll pay the bulk of it, and then you don't have to worry about the rest of it. Well, that's certainly a recipe for charging a pretty high price in the first place.
Well, and the law, I guess if I understand it correctly, the way that the law states is that if you live in the Lake Ozark Fire Protection District, and again, it goes back to 2000, and it says that you would not be charged by the district for ambulance services if you're not covered by an insurance company. Is that right?
Well, that's how I read the article here, meaning that you're not charged for out-of-pocket costs, meaning, as I interpret it, that let's say they send the insurance company a bill for $680 and the insurance company pays $500 of it. You don't owe the $180 of it. Also, if you don't have any insurance but you're a taxpayer, you don't owe any of it. So what you don't owe depends on whether you have insurance or not. Generally, I think they certainly prefer people to be insured, as everybody should be, and to pay for the insurance company to pay the bulk of that bill. And for out-of-state residents, out-of-county residents, they owe the full price of it, as they should. That's perfectly justifiable.
Now, as you look around the state, is this a common practice for ambulance districts, or is this unique to Lake Ozark?
I don't want to say it's unheard of, but I do believe it's unusual. I don't think it's common, but again, that's not to say Lake Ozark is the only district doing this. I think it works in an area like Lake of the Ozarks, where a significant amount of the property taxpayers are only going to be there for a portion of the year. So the full-time residents Well, everybody's paying the property tax, but a lot of those people being second homeowners are only going to be there for 4 or 5 months a year, or perhaps even less. So that's why the district can afford to give the taxpayers this type of a benefit. And again, there's nothing wrong with that. I mean, you see these issues like it around Missouri, and I'm sure many Ozark residents have been to the zoo in St. Louis and not paid to attend because taxpayers in the city and county of St. Louis are paying taxes to support the zoo. This is just like that situation.
Yeah, essentially, the money that comes into the Lake Ozark Fire Protection District, and again, if I'm understanding this right, that money that comes in through the property tax assessment, that they receive some of that money. So that basically covers their cost for most services they provide the residents of Lake Ozark and then also the visitors as well.
Right, and that tax rate, I was able to see the 2011 tax rate, so it might have slightly changed since then, but it's about 82 cents per $100 of assessed valuation for both the fire service tax rate and the ambulance park tax rate, and that's fairly high. I certainly wouldn't call it obscenely high, but the taxpayers of the community are funding this. The sort of the per service charge is just to cover the marginal costs, and also it's there to prevent people from abusing the service. That's one of the reasons you do have to charge for it. You don't want people calling an ambulance because they have a cough and they want the ambulance to give them a free ride to the hospital. You need to charge to prevent those things, to make sure that the ambulance service is used for true emergencies or at least serious health issues.
Well, and especially in areas down here in Lake Ozark. I mean, you've driven through portions of Lake Ozark here. It's not only do you have a lot of winding roads, but it's not real easy to get from point A to point B around here sometimes either, and especially if it's a medical emergency.
You make a great point. There certainly are going to be second homeowners, tourists who don't know the area very well, and the rides can be dangerous, certainly if you're having even a minor emergency. So that's a great point, Manny, about imposing the charge, but you do want to, in those cases, encourage people maybe to call an ambulance. So I'll sort of amend my prior point with the excellent points you raised, that even though you don't ever want anybody abusing the ambulance service and using it as a taxi cab service, and you can get that in certain areas that don't charge it at all, that don't charge per ambulance ride. Yes, you want the tourists and the people who don't know the area to be calling it, but you want to charge them for it. You shouldn't be subsidizing the tourists with local tax dollars.
And you made the statement about what this is kind of saying in general, not necessarily this policy, but others in general with the current healthcare system. Is there any way to see what this is going to do once the healthcare mandate comes into play in 2014?
Boy, that is a great question, and I wish I knew the answer to it. I think that the healthcare mandate won't too heavily affect fire and ambulance services like this. That said, if, because of the mandate, more people have insurance, then yeah, I think that this bill will then go to the insurance company, and they'll probably get a little bit more money, and you might have fewer residents of the county who are taxpayers, totally uninsured, sending them back no money. So I think the district might get a little more money out of that. There's nothing wrong with that, and I'm not a supporter of the healthcare changes that probably won't surprise your listeners. But I think you could have a positive effect for the Lake Ozark Fire District.
Yeah, and it's really interesting because we have so many different fire departments, fire districts, ambulance districts here at the lake, and obviously that is all in the interest of public safety, and different departments have different equipment, they have different personnel. I mean, some have a lot, some don't have that many, but in the end, it is obviously difficult for them as well to work through a lot of, honestly, governmental issues when it comes to who gets reimbursed or who doesn't get reimbursed and who has to deal with the insurance company and who doesn't.
The whole system is so unbelievably complicated. That's why it's a good thing that the district and probably most fire districts contract out their billing to companies that specialize in healthcare billing, because it is extremely complicated, and the potential penalties if you make a mistake and accidentally break the law or violate some sort of HIPAA regulation can be severe. So you want the people outsourcing that, and as you said, the variety of ways we provide ambulance service in Missouri would surprise people. There are fire districts that do it. There are municipal fire departments that do it. There are independent county ambulance districts that do it. There are independent sub-county districts. There's a lot of hospitals that provide their own services completely and do it privately. And a lot of those private ambulance services work just fine. But there is no tried and true and standard way of doing it in Missouri. And it's hard to compare what Lake Ozark does, particularly on the taxes, to other fire districts in the area, because as you sort of stated, the level of service provision can be very different. You can have a much lower tax rate, but that lower tax rate at a neighboring district might be for a volunteer entity that provides a lower level of service. So these are all the types of things that enter into the choices people make when they buy homes and figure out the taxes that they pay for those homes. It's all, and we've sort of written about that as well in a Show Me Institute study on property taxation that I wrote that people can also find online.
We're talking with David Stokes from the Show Me Institute here on Show Me at the Lake on the Morning Magazine on News Talk 1150, 97.5 KRMS. Before we end our time this morning, David, we had talked last week about the public hearing that was held on Tuesday in Osage Beach with the fire district and the proposed change to the dock inspection process. And we'd actually talked about the testimony that you had sent to the fire district. I think that went up Monday afternoon, actually, on showmeinstitute.org. Did you get any response from the fire district at all?
Just a confirmation that they'd received the testimony, so I'm confident it was entered in, and thank you for giving out the website there. I read a news story at Lake News Online about it. It sounds like the public hearing was unfortunately not that well attended. There were certainly some people who were there, and I think the fire district is going to move ahead with some small changes to dock regulations. I think these changes are perfectly appropriate. I just really hope that when the Lake Ozark legislators next year, there's been discussion that they're going to seek some sort of wider legislative authority to do these inspections area-wide. And if they do that, it's just imperative that it not become a fiefdom, that if you want proper dock inspections, affordable and easy to schedule and easy to follow the new rules, you have to make it a wide-open system where private electricians, county inspectors, and fire district officials can all perform the electrical inspections. And if you do that, you'll have competition for it, and that will be good for the homeowners.
Well, I do know, and if you're not aware of this, I guess you're finding out now, that other fire districts are considering the same possible change. So that it may not just be Osage Beach that does implement this, but other fire districts have also inquired about adding this on as well.
Right, and that's, again, the requirements as put forth I don't think are a burden, and I think are fair and reasonable. And I wouldn't even object if the inspections required with somewhat more frequency. But I know that there are parts of the Ozarks that are not covered by sort of professional fire districts, the more outlying areas, and that's where they might need some state legislative authority to enact DOCA regulations. And if they do that, I think that would be fair. They just need to keep it in an open process. And as more fire districts copy what Osage Beach is doing, I just really hope that the taxpayers of the area insist that they don't maintain the authority to do the inspection only to fire district inspectors. You need to include the private sector in this purpose, and you'll really make it easy for people to follow the new regulations, and that's when you're going to start saving lives.
David Stokes with the Show Me Institute. Please give us that website again where folks can see the testimony that you gave to the Osage Beach Fire Department, but then any other articles or commentaries that the Show Me Institute has put together.
You can see it all at showmeinstitute.org, and your listeners can follow me on Twitter at David C. Stokes, and they can follow Show Me Institute on Facebook as well.
David Stokes with the Show Me Institute. As always, sir, thank you for the visit. Have a great weekend, and we will visit with you next Thursday here on the Morning Magazine on KRMS.